This is the training workshop for patient care to improve staff performance here at Brownsville Memorial Hospital to lower risk and increase patient protection. Concerns to address: communicating clearly. Know what you want to say to the patient and practice how this information will be presented. Encouraging patients to ask questions. By asking patients questions, it gives a clearer picture as to their understanding and what needs improvement or clarification. There are other concerns such as educational materials. However, addressing these 2 points will address all of the concerns, as these are key in all communication. Importance of health literacy. People are more likely to follow treatment and ask their healthcare providers for help if they understand what the treatment is for and they feel confident in their healthcare team. Making sure that patients are comfortable will ensure a better atmosphere for learning as well as for seeking help. It will reduce anxiety and boost trust. Communicating in plain language is the best way to communicate without confusing patients or complicating the issues. Most Americans read and write at a 5th to 8th grade level, so it is important to speak to everyone as if they may have reading difficulties. Assume that everyone needs extra assistance. If they don't, they will still be appreciative of your approach. Importance of addressing concerns. It's important to communicate in a way that all the patients will understand and want to comply with their treatment. Keep communication simple. Do not overwhelm the patient. Patients must feel heard and understood in order to comply with treatment and ask questions when needed. Frequently asking questions such as if they have concerns and then addressing those concerns show that you're listening and that you care. Patients must be made to feel comfortable to come to their healthcare provider with medical issues, medication concerns, and side effects. If they ask a question, do not judge. Side effects are serious and a patient should understand what they are and what to look for. Patients should receive instructions in their preferred language. Understanding treatment instructions is key to compliance. This should be established first to ensure all information is understood and well received. Be patient and clear with your patients. It takes time to accept some diagnoses. Do not get frustrated and do not rush them or your explanation. Be courteous and lenient about time. If the patient needs more time, schedule another follow-up appointment to address all other concerns. If the questions can't wait or cannot wait to be answered, provide resources for further assistance, such as a social worker. Know your patients. Have a general knowledge of your patients, such as their gender, their age, their culture, and language. Who are they? Know your community and their beliefs. It will make it easier to communicate. Use humor when appropriate. Not all situations can be handled with humor, but humor can be used to ease tension, such as the sign here. Warning: patient will be charged extra for annoying the doctor with self-diagnosis gotten off the internet. See how the patient accepts this. If they laugh, then you know that it is acceptable to use humor. You can also state, if they are quiet, "Wow, you're very talkative today." This may also help to ease tension and make them more comfortable with you to open up. Gauge if there is understanding. Be observant of the person and their body language, their facial expressions, and their gestures. Do not use medical jargon. Use simple terms. Not everyone understands medical terminology, such as any side effects in medication if you stop, such as myocardial infarction. This is not always understood, but a heart attack is more commonly used. So you can say, for a warning, stopping your medication may lead to a heart attack. Repeat and request feedback. If needed, repeat the information. Use different wording if necessary. If you notice that the patient is not understanding, use different approach or different wording. Visual aids may be helpful here. Ask the patient to give their understanding of information. Have them repeat back or teach back what they understood. Use medical interpreters whenever necessary. If you cannot communicate effectively due to language barriers, always use an interpreter to assist. Be sensitive to culture. Also be aware of body language. Depending on the patient's culture, there may be remedies that they use or beliefs in certain things, which may be harmful when used with certain medications. Discuss alternative remedies while being respectful and understanding of their practices and beliefs. Again, observe body language, as it can speak volumes on the person's comfort with you and the information that they have received. Here's an overview of the exercise. We want to make sure that you're using clear language. Go through a list of words to use to simplify language. Write a few sentences to describe the goals that you have to reach with each patient, and describe how you want to be talked to, how you yourself wish to be addressed. Areas of concern. Change the language, again, that you use with patients. Keep it simple. Understanding how people wish to be addressed and information they want. To be mindful of how you are talking to people. Would you like it? And also watch your tone. Being empathetic to others and their views. Cultural sensitivity. Think of what you hold to be valuable and important. What is culturally significant to you? Would you want someone changing your practices or talking down to you about the things that you believe in? Gauging patients' challenges and being receptive or observant of the issues. Can the person read or write? Are they nervous, as this may affect how they perceive the information that you give them? Do they have a support group? Again, listen and be observant. Materials to be used. Videos of patients and their worries to be viewed. Watching scenarios and viewing some challenges may help you to understand some approaches as well as some vulnerabilities that your patients may have. Of course, use a pen and paper to write down how you wish to be addressed. Take notes. Jot down questions to ask patients. List of words, simpler terms to be remembered when talking to patients. You can even use a script for informing of diagnosis and treatment. Know what you will say to your patient in simple terms. Make a list of questions to ask in order to gauge your patient's understanding or possible worries. Have some questions ready for your patient to ensure their understanding. And visual aids. Sometimes pictures may be helpful to help patients understand or to remember instructions, such as a sun or a moon, like take pills during the day, which is the sun, or at night with the moon. You can also color code this to help them remember which pills. So, a blue sun for morning, a blue pill in the morning, or a yellow moon at night, a yellow pill at night. Here are some group activities. Role-playing will allow you to understand your patient and the difficulties that they may face. Listen carefully to what your partner states back to you. During these exercises, you want to listen as part of good communication. Hear what they are saying and then use it in practice. What did you understand? How will you take your medication? Again, see what your partner is doing and try to observe. Do they understand what you're saying? Give feedback to your partner, explaining what you feel they did correctly and what needs improvement. How can we improve our techniques? This is important. And again, all feedback shall be reviewed and discussed to ensure the most effective ways of communication with your instructor. Practice empathy. By being empathetic, you place yourself in others' shoes, and sometimes that is a vulnerable place to be and can be scary. Be mindful of the fact that we can all be in that situation or position and would want to be comforted. Good practices. It is good practice to listen. Sometimes listening is all that someone needs. It allows one to be understood and know that the needs are there, and will also help the practitioner to take action. Discuss understanding with patient. Ask questions and have patient ask questions. Again, keep it simple. Be creative when possible, but be sensitive to the patient, such as using humor. Again, gauging if it is appropriate. Use visual aids if reading is difficult, such as colors, pictures, and videos, to help the patient understand. Ask and help establish a support group. Ask them who will help you. Or see if a social worker is necessary and needed in certain situations. Go over treatment and resources. Who can help for discounted medications or charity care when a patient has low income, as well as dosages and possible side effects to look out for. Always discuss this with the patient and make sure that they understand. Thank you for your time, and here are the references used for this presentation.